by show of hands, has anybody been to Honduras in the past? Okay. I've had the privilege of taking 3 of my 5 children to Honduras. And we've gone there and we've built houses. We've actually harvested pineapples in the mountains. And it is just a beautiful, beautiful place. But there's something else about Honduras that it's known for. They're known for a bridge, a famous bridge called the, my Spanish isn't very good here, chalupa, or that may actually be something to eat. But there's this bridge that was built many years ago, and in 1998 there was a hurricane that came through. And this hurricane came through and it demolished about 150 bridges. Hurricane Mitch, I don't know if you remember back that far, but there was actually 75 inches of rain within a period of 4 days. Can you imagine that? That is just astounding. Now, the thing about this bridge is it was built very, very well. The engineers were the sharpest, the brightest. But you know what happened with this bridge? While it still stood, it wasn't functional anymore. And the reason why is because the river moved, okay? So I'm here today to talk to you about how the river has moved in healthcare. Okay, I represent a company by the name of Smith&Nephew. You may have heard about it. It's in Memphis, Tennessee. We're actually a pretty large company. We've got 11,000 employees in more than 90 countries. We have leadership positions in orthopedic reconstruction, hip and knee implants. We do a lot of sports medicine and trauma, and we've got the best-in-class advanced wound management dressings. So the other thing that Smith&Nephew is known for is a little thing called innovation. In 2013, Smith&Nephew was the only medical device company that made the Forbes list of most innovative companies. So I'm here to talk to you about one of those innovative things. It's Visionaire, and it's a big brand, and some of you may have heard of Visionaire if you're in need of a total knee or a total hip. But Visionaire is something that's, we do 3D printing, right? We do 3D printing of patient-specific instrumentation. But Visionaire is actually much, much bigger than that. It's about leveraging patient data, and we do that for 3 different things. First of all, we improve accuracy for the surgeon and the surgical procedure. The second part of it is that we look at improving efficiencies. So Visionaire is actually things that allow us to be more efficient in a hospital. And then lastly, we've got this opportunity to provide confidence to the surgeons and to the healthcare systems that we work in. So when we think about that river, the river that we're used to playing in is over here on the left-hand side. When we go into a surgery, our salespeople, they come in with many, many instruments, many implants to support that case because they have no idea who's going to be there. And so they have to be prepared just in case something goes wrong or just in case this patient may be a little bit bigger than the last patient. So we're actually moving, the river's moved to now, with all the information that we have out there, we know ahead of time who's coming to surgery, right? We know what size they are, so we don't have to bring the little ones in or the large sizes in. And that does one other thing for us too, or actually a couple other things. If you look here, we've actually brought all of this information inside Smith&Nephew. We get MRIs, we get x-rays, we get all kinds of information. They go through our system, and by doing that, what it allows us to do is it allows us to be like FedEx. Right? It allows us to be better at logistics. So instead of having $300,000 worth of inventory supporting a case, we can provide just the instruments and just the implants for you or for you. And that's a big deal. The last thing that it does is it allows us, because we're getting data all the time, it allows us to know how things are going in a short amount of time rather than waiting 5 years for clinical results to go out. So there's a lot of opportunities with what that information gives us, but we've got a problem. Okay, and that problem is we are a heavily regulated industry, and we have something that we have to look at. It's called HIPAA guidelines, and this is about patient-specific information, patient private healthcare information. Anybody heard about the, what is it? Is it the Apple Cloud or the Amazon Cloud and the Hollywood problems? Have you heard about the banks being hacked? I mean, can you imagine your personal information, those things that you don't want anybody else to know, being public information by somebody hacking into it. So there's a lot of regulations around it. So what we're looking for is we're actually looking for a scalable solution where we get all this information in from x-rays, from MRIs, and they have patients' names on them. So we have to somehow, if that's a word, anonymize them so that we can use that information to provide the best. We've got all the encryption and all that right now, but everything that we have has a patient name on it. So we're looking for solutions that we can take some of that risk away. And what that allows us to do is it allows us to do different things and more things with the information because it's no longer linked to a patient. So what are we looking for from a project detail perspective? The goal is to complete this by October of next year. We're looking for a partner that hopefully we'll identify in the next month. The plan is to define the scope of work in the first quarter, and this is a very dynamic world we live in, so there could be some changes that are going on. The process will be to create a project plan and initiate development by the end of the second quarter in 2015, and then hopefully a pilot by the end of next year. We do have a large group of IT people that are part of this, so it would be a collaborative effort, and it would take a lot of opportunities for synergies. Lastly, we'd like somebody that understands MATLAB, and Python is not the language of choice. Practical experience with patient health information really isn't that big of a deal for us. If you have that, that's nice to have. And then lastly, familiarity with various medical imaging formats. So what we're asking for is we're asking you to help us make a new bridge to cover a river that's changed. Any questions?
There are quite a few test data privacy and data privacy products already out on the market. Have you guys taken a pretty good look at what's out there from, say, IBM, HP, CA, et cetera?
So we have our entire system has been, for lack of a better term, piecemealed together. And so it needs to be kind of a collaborative group of, we've looked at them, they don't work. How's that? That's probably a better way to say it.
You started to go technical. And then
yeah,
you
I know.
okay,
I don't want to do that.
So are you looking for someone who has computer vision software programming experience in MATLAB? Is that the kind of thing you're interested in when you have all these different imaging data sources and you're interested in putting them together?
Yes.
All right. Excellent.
Smith&Nephew.